Do you feel like you're tired and sore all the time from inflammation, but are trying to avoid prescription medications? Well, today we're going to be speaking about a non-pharmaceutical, evidence-based way to reduce inflammation. That's right, we're talking about curcumin. My name is Dr. Sonia Malani, and I'm a board-certified integrative oncologist. So what is curcumin? Curcumin is a polyphenol and bioactive compound that is found in the turmeric root. The turmeric root is within the ginger family. It's a dietary spice and perennial herb and is known to grow in countries like India, China, and Indonesia. It has a bright yellow pigment to it, so if you've ever tried curry powder or had Indian food, you will likely see that bright yellow tinge to it that comes from turmeric. How does curcumin work? So curcumin is actually the part that has its anti-inflammatory pathways. We know that curcumin works by inhibiting inflammatory pathways and neutralizing harmful free radicals in the body, which may reduce inflammation and oxidative stress. Curcumin has been studied for its potential in managing conditions like arthritis, heart disease, and certain inflammatory conditions. The benefits of taking curcumin may include reduced inflammation, improved joint health, and potentially lowered risk of chronic diseases. In a double-blind, randomized control pilot study, 28 patients with chronic kidney disease on hemodialysis were administered curcumin for 12 weeks. After 12 weeks, a reduction in the biomarker of inflammation was observed. This biomarker is known as tumor necrosis factor alpha. This type of study supports that curcumin has an anti-inflammatory benefit and can be used alongside patients with a chronic illness like chronic kidney disease. The risks associated with curcumin use are generally low. However, some individuals may experience gastrointestinal discomfort. Remember, if you have a known allergy to turmeric or curcumin, you should be avoiding this herb. It may also interact with certain medications, so it's important to consult a healthcare professional before you start to use curcumin. How should curcumin be administered? Well, the appropriate dosage can vary depending on the individual and their specific health concern. Some common dose vary between 500 milligrams to 2,000 milligrams of curcumin per day. So it's important to be working with a healthcare provider who understands your specific health concern as well as your specific health goals. If you're curious about whether you can add turmeric to your food, remember that 1 teaspoon of fresh turmeric powder has about 200 milligrams of curcumin in it. So in order to get that therapeutic dose, you may have to use a lot of turmeric to your food. If you want more videos on root cause medicine, please make sure to subscribe to the channel.